I'm going to talk to you guys about individuals with a Fontan circulation's neurodevelopment, and want to start with a disclaimer by saying I am not an expert in this field. I've done a lit review, and so that's really what I'm sharing with you today. So I want to structure this talk by looking at three things. I want to look at how it presents in individuals with a Fontan circulation, what contributes to neurodevelopmental deficits, and what can be done to improve outcomes. Now, what is neurodevelopment? Neurodevelopment refers to the brain's development, and variances in development can influence the brain's performance and functioning. So how does it present in individuals with Fontan circulation? Well, the first thing to say is that it is recognized as a significant coexisting issue. But there is huge, and I'm huge, inter-individual variation. So up to half of all complex congenital heart disease patients are not affected at all. Others are affected in one area. It might only be very slight. Others still are affected across a multiple range of areas. There are many patients with a Fontan circulation whose neurodevelopment and IQ are in the average or the above average range. So really important to keep those in mind as the talk progresses. But studies also continuously identify neurodevelopmental, I'm going to struggle on that word, neurodevelopmental patterns which are towards the lower end of the normal spectrum for the group as a whole. Again, some people might only have very subtle differences. One of the problems is that there are no longitudinal studies tracking neurodevelopment through to adulthood, but some of the cross-sectional studies, which are again taken at a point in time, do show that neurodevelopmental impairments can affect people across the lifespan. So I'm going to give you some examples of what I mean when I talk about neurodevelopmental stuff. So when, for example, if we're looking in the preschool age at speech and language. Receptive language, so that's when you hear and you understand the word. So if you say point to the apple, that the child will be able to point to the apple. Expressive language, this is where you're using words and sentences to communicate. So if you say, what is this? And you're holding up an apple, that might be the bit that's more difficult. Or people might have trouble saying it or organizing their sentences around that topic. Motor skills might be another area where people are affected. So there might be some motor delays in reaching developmental motor milestones, sometimes some clumsiness, so that's some of the large motor skills. Some of the fine motor skills, such as problems with buttoning and zipping, as well as difficulties with visual motor skills, such as drawing, might be evident. And learning handwriting can be a particularly challenging task, so where you need to see the letter on the board, know what it is, and then get the hand to make the letter on the paper. So those can be really challenging. In the social emotional space, people might have some difficulties reading emotional states accurately, and this can be particularly affected for those who have symptoms of the autistic spectrum disorder. Executive function is another area that's affected in some people. So these are the skills that we use to complete new or complex tasks. So the skills that you use to plan, to organize yourself as you approach a task, and that to regulate your behavior. This sort of stuff in the executive functioning space. So for example, children might have difficulties following classroom routines. And in adolescence, this may manifest as difficulty remaining flexible in social situations. So just a couple of examples there to give you an idea. Memory, in general, does not seem to be affected. And then long-term, well, we know very little about what happens long-term. But some researchers do speculate that the natural aging process could affect neurodevelopmental issues further. And then these are some of the domains that it affects. So it could affect people in their academic performance, as if they have any kind of motor issues, participation in sport or physical activity, their social interactions and close relationships, emotional self-regulation. We might see some risk-taking behaviour, and even into adulthood as people head into employment. I've put there on the side as well self-management of cardiac conditions, so adhering to recommendations, particularly during the transition stage, that can be something that can be quite difficult. So what contributes to these deficits? Well, 70% still unknown, so huge portion. 25% seems to be an innate patient factor, so gender, birth weight, any known genetic anomalies that people have, and then parental stress and mental health, which I'll talk about a little bit more. And then, interestingly enough, operative factors, including bypass, actually a very, very small proportion, 5%. So I think this was, one of the most interesting things when I was doing this literature review. And it's only more recently that we've been able to actually talk to that number, because a lot of people used to think that it's the surgeries and it's the time on bypass that were really affecting neurodevelopmental outcomes. And when we look at the larger numbers of the data pulled together, it's actually a very small proportion. So some of these structural brain changes are already evident before birth. So when we look at babies preterm, so in the womb still, pre-birth, there's a delayed brain maturation, similar to what we see in babies who are born preterm. There might be some structural brain changes. There might be more white and grey matter anomalies. We sometimes see smaller head circumference. We sometimes see lower brain volume. There might be some structural changes, and those structural changes set in place a greater brain vulnerability over time. And, for example, in hypoplastic left heart syndrome, we know there's altered fetal blood flow. So there's a reduction in the nutrient and oxygen-rich supply of blood to the brain. This is just a slide which shows that there's only a small number of structural changes in the brain of single ventricle fetuses. The top part, which with the brains there, that is showing you some cortical gyrification. So you can see those brain folds becoming more complex in time, before birth and then after birth. But when we look at the actual numbers, so you look at B and C, the difference there between hypoplastic left heart syndrome and babies with normal hearts is actually quite small. Other contributing factors, any oxygen deprivation, strokes or brain bleeds, those increase the risk for poorer neurodevelopmental outcomes. And then long-term hospital stay can also be a factor. And of course, longer time in the hospital means more time away from stimulating learning environments. So that's another factor that contributes. So, well, now what do we do? What can be done? Well, firstly, we think this is, we really need to set people up for maximum success. So where possible, early elective births should be avoided. And implementation of best practice in surgical and post-operative care. And then once we've done our best in that space, and there's still some neurodevelopmental deficits established, how can we now improve it? Assessment is a really important component, and the American Heart Association guidelines recommends early identification and continued surveillance. And we would really say that surveillance needs to be across the lifespan. So we do see a heavy emphasis early on, but that needs to continue across the lifespan. In the individual intervention and optimization space, these are some of the first lot of things you see there are things you're probably familiar with. And these need to happen early, and again, I will say ongoing. So physical therapy, occupational therapy, speech and language therapy, psychology, educational support, teacher aids are very useful. And then turning to some other things. So computerized training There's a large trial at Boston Children's Hospital at the moment where they're using a computer program called CogMed, which focuses on working memory training, and that is an important part in improving executive function skills. So we're very interested to see what those results will tell us. I'm going to say it again, exercise, aerobic exercise, that is linked to improvements in social and cognitive functioning. And then mindfulness and meditation and relaxation. You're thinking, what's that doing up there? Well, that helps with self-regulation, skills, and emotional regulation. So, you know, we need to think about all of these things in the neurodevelopmental space. Some targeted interventions in reducing anxiety and depression, and then also employment counselling. What might suit your skill set as an adult, and how can you enhance your skill set to reach your employment goals? I want to turn to the family context. Then one of the factors that continuously shows up to affect neurodevelopmental outcomes negatively is parental worry. It's been shown to account for 28% of the variability of child behaviour adjustment in the first year of school, which is 5 to 10 times more explanatory than surgical or intraoperative factors. Now, we know worry is not conducive to creating an optimal learning environment. It shuts us down from being curious and exploring as we focused continuously on what if, right? And we run those scenarios through our minds, and children pick up on this. And there are some great programs which aim to minimize the impact of trauma and reduce parental worry, including the family coping program, which Hard Kids runs, and which we've already mentioned today. Now, of course, I'm not saying that you shouldn't worry and just be happy, because it is part of the parental job description to worry. But it is when your worry starts becoming unhealthy, and it's the 25th time that you're running through that same scenario in your head, that you might need to look at it. So one way to start catching your worrying thoughts is just to start noticing them. What are the things you worry about? Are there some patterns? Some people might find it helpful to write it down. Mindfulness can be very helpful as well in focusing on the now, what is happening right now. And there's also some great free apps and resources to help you become more mindful. I've mentioned a couple there, the 10% Happier app, Calm, Headspace. Those are not endorsements, those are just some that I've come across which are useful. Some concluding remarks. Well, intervention services and how well it works has not been studied in depth. So we know that some of these things work at an individual level, but we've not collectively studied this. And it's not been studied across different ages, particularly for adults with a Fontan. We know early intervention makes the largest gains, but can we keep fine-tuning all the way into adulthood? So really, more research is needed to confirm which intervention services work best for people with a Fontan across the lifespan. There's a huge portion here that's still unknown, 70%. And one thing we want to do in this space is some further research. We've put a big grant application in to the NHMRC where we want to look at improving neurodevelopmental outcomes. And what we want to do here is study those born with a single ventricle from before birth and follow them through. And we want to include some fetal MRIs and a whole bunch of genetic screening and really start unpacking what are some of these 70% of things that are still unknown. So fingers crossed we get that one. We should know in the near future. So just to recap, I've touched on the presentation of neurodevelopmental issues and factors influencing deficits occurring, as well as some interventions to improve neurodevelopmental outcomes. And really, you know, what we've been doing with the registry is, and with all the good work in this Fontan space, is we've helped people with a Fontan circulation survive. But really, I think the next challenge now is how we need to help all of you thrive. Thank you.
So now is a really good time because you have a bit of time, half an hour, to ask what all remaining questions, things that have been through your mind that we haven't debated yet. While you're gathering your thoughts, I'll just say a little things because that is a very good talk. It's always confronting to talk about neurodevelopmental outcome, and I think as those with a hypoplastic left heart, thinking about your baby in your tummy being deprived of all the nutrients and oxygen. So what can you do for it? It's unfair, but there are things to do, and that's the message I'd like to give. In the action plan that we've been asked to draw for by the government, that Lisa alluded to this morning, clearly we're going to build that up. So we want to have neurodevelopmental outcome assessment probably at 4 or 5 years of age, before school age likely, so that we can do intervention on the children when we notice any small deficiency. There's a crying need for psychological support from antenatal diagnosis and throughout the whole life course of having a single ventricle, and we all committed to provide it, but that is going to be a few years before we get that. So the difficult question, and I will invite Gavin and Andrew maybe to answer that, is what can you do? If you're in Melbourne and you have a 3 or 4 years old kid, we do not have the facility to do these neurodevelopmental outcome assessments. So it requires an hour of somebody who knows what they do. They don't have to be doctors, but they have to be trained for that. And you can do things. If the right age sometimes, otherwise, if you do not have access to that, it's probably the beginning of school. I think at school they're sensitive. The first year or two of school, they look at your kids. And that's the time you can see whether you need a speech therapist, you need a bit of physio or something, and a bit of extra help, because this extra help, we don't have the proof on the long term, but it's likely to be helpful. And then the last point I want to insist, we do not have psychological support, and I try to give the message over and over that you have to look after yourself as parents. It's all about the kids, but you have to look after yourself. I have, because of these meetings, because of the conversation I have with mums, I recall that mum, telling me, and I had that things several times. You have 20 years old, mums from 20 years old people with Fontan circulation, they tell you similar stories. Every time when they were kids at school, they were going to the swimming pool, and then they had people coming to them and say, oh, is it a bit blue, or is it cold, or is it a bit pink, or something. Immediately it's like a feeling of guilt or something that is wrong, and anxiety is just building up immediately. That's what you have to look for, and that's, you have to be aware that your mental health is influencing your kids, and that's the best way you can help, is being well in your boots yourself. Easy to say. Gavin and Andrew, if somebody in a family comes and asks you, what can we do to assist neurodevelopmental outcomes? What's your answer? Do you have any tricks or tips?
I think those services are available, Eve, but they're accessed really by exception almost. So when a problem's identified, I think that we can certainly get those services. But really, I think what you're talking about is is embedding those services so that there is that early intervention. It's that first 1,000 days concept that we need to be starting early, and those services need to be continuous.